From our 5 clinical studies that has been run in Thailand, we found that the effect after 3 treatment sessions will last at least 6 to 12 months. So which means it lasts pretty long, but you need a series of treatment at the very beginning.
Hi, I'm Dr. Jessie here from Kaiteki Clinic of Malaysia. So today we have the most gorgeous Prof Rungsima with us from Thailand.
Hi, my name is Rungsima. I'm now the chairman of the Department of Dermatology at Siriraj Hospital, Mahidol University. And I'm also running the Skin Laser Center at Siriraj Hospital.
So today we are actually here to discuss on this most popular skin booster treatment. It's the polynucleotide with DOT technology. So they like to call this the game changer in skin rejuvenation. So Prof, what's your take on this?
To be honest, this is not the new concept anymore. But of course, we have been using other injectables for years, 20 years. We use botulinum toxin and we use fillers, right? But I think now what we need is a trend of the skin quality improvement. So you know that toxins and fillers can help with some of the skin quality, but people really need to get something that is more like preventive or regeneration, because we don't want anything to be too much or overfill. So that is why I think like with the trend of skin quality, we are trying to find something that can improve the skin quality in any way.
So moving on to, some other questions that, some of my patients like to ask me in my practice. So if PN is also an injectable, fillers are also injectables, how are they different? Are they the same?
Oh, definitely, totally different. I'm not so sure in Malaysia, but in Thailand, the fillers that has been approved in Thailand before is only HA, so hyaluronic acid. So far now, we just recently have non-HA filler approved, like in about less than 2 years. We use HA fillers just for maybe 2 things. The first one is filling the volume on the fold. And the second one is to contouring the face. So, you can adjust it. And in fillers, you had a different viscosity. Like, you had a very light filler where you can place it on the area where the skin is thin. And you can also have the very strong fillers for the contouring things. It's a good thing because we use it for 10 years or more. But, there is a tendency that we are overused because HA is actually a strand of sugar. So when you put it into the skin, it can swell because it attracts waters in. Yeah, so volume can change. So which means when you use it in a wrong way, it can cause overfill syndrome and it can make us look a bit weird.
Yeah, like more puffy or because of the water retention.
Yes, and also it can have another complication, like, if you are not injecting it correctly. And again, when you see a lot of complication, you get scared, right? PN is again different. The viscosity is very low, so you can see it's like a drop of water. And when you add it into your skin, it's less volume increase. So which means if you really need volume increase or filling the hole, this is not a product for you. But PN itself can have a lot of effects in biophysical property of the skin, and it can also regenerate in terms of the wound healing things, as we discussed before. So I think this is the 2 main things that is totally different.
Does that mean that the PN dot is only suitable for older age group with aging skin? Or do you also do PN dot on younger group of your patients?
To be honest, for me, I think if I would want to choose PN dot for anything, the first area that I would want to choose is the thinner area, no matter young or old. But of course, like when you are old, you get thinner skin even more. The second area that I would want is the area where I need to improve the elasticity, especially on the area where the skin is not firm. So if I want to increase the firmness of the skin, definitely no matter young or old. But of course, in older age, you get that kind of flaw more than younger generation. But I think like we need to know what PN dot can really help and change the skin, and then you can choose the patient that had that kind of problems.
Yep, I also actually see a handful of younger patients where I treat their indications like some chronic atrophic scars, patients with very long-standing hypersensitive skin, so PN dot. All right. Well, when we talk about younger age group where they also start having a bit of a skin laxity, somewhere around ranging from mid-30s to mid-40s, where because I see this increase of demand of younger patients asking for skin longevity treatments. What's your take on this, Prof?
There is a concept that we call prejuvenation. Instead of anti-aging, we are doing prejuvenation. For me, to be honest, it's good for the younger generation to think about prevention. For examples like myself, I think my best strategy for my prejuvenation of my skin is using sunscreen. When you start, so I start using sunscreen since I was 17. So now 52, my skin doesn't look really 52. I think that is the concept of prejuvenation. But of course, that is only using sunscreen. It's just topical, right? But if you really need to do any injectables, I also recommend my patient to, first thing first, combine. If you can use anything that less invasive, try that first. In super young, like 20, and also you had also the PDRN technology that can really use as cosmetic. So that might be a good start. I'm not really do injection in 20-something years old, but I might think it would be good start if you can see some sign of aging, a little bit of sign of aging. For example, if you start having lines when you have facial expressions, it might not be a good way to start. But if you start seeing that line even without facial expression, or that line stay too long, I think that might be the good timing to start prejuvenation. And I think that could be correct for every procedures.
Okay, so we've made PN dot sound so interesting. Prof, can you walk us through on the treatment protocols that you usually apply in your practice?
I think it depends. But usually, since this is not something that can really change in one time. So I think it's like you're nurturing a plant, you're watering it every day, day by day. It's the same thing. I think PN is the nutrient to help you regeneration and repair things. So you need to do it more than one time. So the protocol that I always recommend the patient is once a month and maybe 3 sessions. From our 5 clinical studies that has been run in Thailand, we found that the effect after 3 treatment sessions will last at least 6 to 12 months. So which means it lasts pretty long, but you need a series of treatment at the very beginning. And the result is different. I think at least it stay almost 9 months to 12 months. It may be significant improve, but you can see that it's going down a bit. So there is 2 choices of the patient for me right now that I recommend. The first one is you wait till a year and then you retreat it again, 3 sessions. Or you can just do the maintenance, 1 treatment session at 6 month time. So I think that could be still, the doctor can discuss with the patient what is the protocol that the patient feel comfortable doing it.
Yeah, I think it boils down to also the patient's budget expectations and also the severity of the indication. So one last question before we go. There are many PN polynucleotide-based injectable skin boosters in the market. What makes PN dot more superior? And if patients are confused, they don't know which one to go for, how do we as doctors guide them to pick the most suitable treatment option for themselves?
So in Thailand at my university, actually, we run clinical study for most of the polynucleotide that has been approved in Thailand at least. So at first, I thought of PN as something that is the same, but it's different brand. So like toxin, like Botox, no matter what brand it is, it's reduced wrinkle. So that is easy peasy like that. But with PN, it's actually different because there is multifactorials in it. At least combined between dot technology and other technology, I feel that the dot technology only can have what we call the rubber band like character of the skin. Like, it would be very give the skin firm, and when you stretch it, it snaps back faster, like on the neck. So when you age or the skin is thin, or under eyes, when you pull it, it would be easily pulled because it's not firm enough. And then when you release it, the skin is not really snapped back at place. So that is show the sign of aging. And the PN with dot technology can improve that character like so effective. In contrast, like some of other PN, you see the opposite result. Like, it gives the pliability to the skin, it's stretched easier. So I think it's between what you want and what products in your hands. But most of all, I think both clinicians, you need to really study your product, and also you need to give the right information to the patients. For all the patients, I think for me, I think you should go to the doctors who really know what they are doing. Of course, like you need to choose the product that is approved and had clinical study back up enough. Like, because not all PN are the same and it's interchangeable. Discuss with your healthcare practitioner before going for it, and of course, searching for all information before you make decision.
Yes, that's such an incredible sharing. Thank you so much, Prof, for your valuable insights. It was really, really nice discussing with you on this topic.
Thank you for having me.
Bye-bye.